Hello, this is Ronald R. June, and as you may well know, I'm a schizophrenic. I've been out of the hospital, the psychiatric ward, for over 10 years. You can't be paranoid without reason, because a psychiatrist could raise your medication or put you in a hospital, and I surely don't want that. You have to maintain a sense of who you are and that you're under self-control when you communicate to the psychiatrist, so that you will gain his respect or her respect. I take risperidol, Seroquel, and Luvox, and I think I've been taking that for about 10 years now. It's been good for me. I suffer with anxiety attacks. They are very fearful. They can last up to 5 hours, and I get them several times a week. They wouldn't let me walk with the anxiolytics PRN, and that's why I don't take it, because I think if you take the anxiolytics continuously daily, it wouldn't help with the anxiety attacks. I did try anxiolytics in the past, continuously daily, and they were of little or no help. Such medications as lorazepam or benztropine. I also took Symmetril. When you have the anxiety attack, let's see, what are you faced with? You're self-conscious. I become forgetful. Memories aren't there to access, to associate with reality. And it's difficult to organize your thoughts. Let's say you arrange cards in a certain way. It would be very difficult to disarrange them and rearrange them as they were under an anxiety attack, where the fear is the dominant emotion that I undergo. I have been trying to understand the reason for the anxiety attacks. I think sometimes it requires paranoia to explain it. Let's see, what did I resolve about the anxiety attack? I'm not really sure. The fear. I've been disappointed with how people reason. They seem to be concerned about the immediate environment without thinking of possibility thoughts of circumstances beyond the environment that could be affecting reality. They are so, I don't know, well, I think that if you don't use the imagination that you have as you're communicating, let's say, with someone, how can you truly understand what the person is saying? But the imagination does not manifest physically. I think the imagination is occurring randomly, and what has to be done is that the random imagination has to be organized so that we can make sense of physical reality, physical life in this world. Did I explain that sufficiently? I'm not sure. I mean, the thought process is basically imagination, right? Visual, words. I guess you would imagine. Can you imagine feelings also? Emotions? As a belief, maybe it can be imagined. The fear, the emotions as a belief. You have to be cautious. I mean, a schizophrenic cannot say anything that comes on his or her mind because of the risk factor. So we have to be secretive to some degree in order to understand what is happening to us with the thinking process in effect. I am able to deduce paranoia. It is not like uncontrollable as if it is induced in me. So you may say that I have it under control. And I think it is necessary to understand this world. I mean, there is a devil and a God, I suppose, right? So they may be responsible for the illness, the schizophrenia. And if they're not revealing anything to us, we're left alone to try to understand what may be causing our illness. What may be causing our illness. So yes, use your medications. Think of it as a safety measure so that you do not become psychotic as you reason to understand the mysteries of life and to understand and to refine yourself as a person. The illness is a growth process, a growth tool to develop yourself to a higher level. I have come to appreciate myself more because of reasoning, being a schizophrenic. As a mental patient, what can I recommend to my fellow schizophrenics? Be not to be judgmental, be conscientious, offer logical responses if you can think of it in time when you communicate. Believe that you are a worthy person, although you may have disturbing thoughts that reason can resolve. I don't read much. I find it boring and difficult. I don't think the educational material contains the information that will resolve issues for a schizophrenic. This is a spiritual illness, and the unknown must be made known. We become paranoid thinking, well, that person knows where my thoughts are, and so that you do not become violent or aggressive, you have to apply reason so that understanding can be achieved to maintain your composure.